Welcome to MediByte. Today, we're diving deep into a virus that affects literally billions of people around the world, but is still so misunderstood, the Herpes Simplex Virus, or HSV. So let's start with a question. What do these two things, cold sores and genital herpes, actually have in common? They seem like totally different issues, right? Well, turns out they're both caused by the exact same family of viruses. And to really get a handle on this, here's how we're going to break it down. First, we'll cover what the virus is. Then, we'll get into how it works inside your body. After that, we'll look at symptoms and potential complications. And finally, we'll talk about how you can manage and prevent it. Okay, let's kick things off with the absolute fundamentals. What is this virus really? At its most basic, HSV is a virus that causes these little outbreaks of blisters that can come and go. And because it's spread through direct contact, it's really, really contagious. And when I say it's common, I mean it's incredibly common. Just look at this number. Around 2/3 of all adults on the planet have some form of HSV. That's a staggering figure, and it's exactly why getting good information is so important. Now, there are two main players in the HSV family. For a long time, we thought of HSV-1 as oral and HSV-2 as genital. But we now know it's a bit more complicated. It's absolutely crucial to understand that their roles can overlap. Either type can actually infect either area of the body. So, how does this virus actually behave once it's in your system? This part is key because it explains why it's a lifelong infection. After that first outbreak, the virus doesn't just disappear. Instead, it gets incredibly sneaky. It travels down your nerve pathways and goes dormant, hiding out in nerve cells near your spine where your immune system can't get to it. Then, certain triggers can wake it up, and it travels right back up those same nerves to cause a new sore. This whole cycle is why the symptoms can seem to vanish completely and then suddenly reappear. And what wakes the virus up? Well, it can be all sorts of things. Getting sick, a lot of stress, even just a sunburn. Sometimes you might not even know what the trigger was. Okay, so we've got the life cycle down. Now let's talk about what people actually experience during an outbreak. For many people, an outbreak doesn't just start with a blister. It often begins with this very specific feeling, like a tingling, an itching, or a burning sensation. This is a super important heads up from your body because it's the perfect time to start treatment. In the case of oral herpes, that tingling usually leads to what most of us just call a cold sore or a fever blister. These little sores then follow a pretty predictable path. They blister, they break, they scab over, and then they heal, usually in about a week or so. Genital herpes is very similar, just with painful blisters in the genital or anal area. Now, while most outbreaks are pretty localized, it's good to be aware that sometimes HSV can cause more serious issues, like infections in the eye, or in very, very rare instances, even the brain. So yeah, the takeaway here is that while it's often a pretty mild condition, it can cause more serious problems. And that brings us to what's probably the most important question of all. What can we do about it? This quote right here is absolutely critical. Let's be really clear. We don't have a treatment that can get rid of the virus for good. But, and this is a huge but, the virus is very, very manageable. Treatment works best if you start at the second you feel that tingle. Doctors mainly use oral antiviral pills like acyclovir or valacyclovir to help shorten outbreaks and make them less severe. For cold sores, you can also get over-the-counter creams like docosanol. And for people who have frequent outbreaks, a doctor might even suggest taking a low dose of antiviral medicine every day to keep the virus suppressed. Prevention is all about empowering yourself and protecting others. Simple things like not kissing someone when you have a cold sore and using condoms make a huge difference. And it's also really important to remember that the virus can sometimes spread even when there are no sores you can see. And that really brings us to the big picture question. If we know this virus is so common and totally manageable, how can we start changing the conversation? How do we move away from fear and stigma and toward informed prevention and open communication? Thank you so much for joining us for this MediByte explainer. We really hope this helped bring some clarity to a complex topic. If you found this information valuable, please give this explainer a like, share it with anyone who you think might benefit, and of course, subscribe to the MediByte channel for more clear and reliable health info. We'll see you next time.